Health disparities within the LGBTQ community are becoming more clear as more people do research. Despite Colorado being considered by many as an inclusive state, experts say that's not always the case. Jaleesa Irizarry explains.
On a college campus with thousands of people, there's often only one place some may feel safe.
This is my favorite place on campus because I feel seen. I just realize the impact these places have can go a really long way.
Carrie Kandrian is an associate professor at CU Anschutz. She knows how detrimental it is for LGBTQ folks to not feel seen, especially in healthcare. According to a study released by the Kaiser Family Foundation this month, 1 in every 3 LGBT adults report experiencing unfair or disrespectful treatment by a healthcare provider. 24% of those LGBT individuals say those negative experiences had an effect on their health.
The way we frame our questions, the way we ask these questions can shut people down. It's awful.
Kandrian isn't surprised by these numbers. She spent much of her career pushing for more research like this.
Overdue.
It took a long time for anyone to listen.
We don't have data, great data on the LGBTQ community, including hospice. And so part of this grant is to help people understand how critical knowing this information, knowing who someone is, who they love, what they want, what they don't want, to radically change the way LGBT people are cared for.
Kandrian is in the middle of a 5-year grant to develop a way to improve care for LGBT older adults in hospice. She says her research shows Colorado is not immune to this issue. These numbers, she believes, it's time to change that.
I hope that these reports don't allow people to continue admiring the problem and really ask them to do better.
The healthcare disparity is even greater for LGBT people of color. 24% of Black LGBT adults and 15% of Hispanic LGBT adults say they were treated unfairly by a healthcare provider. That's compared to 4% of white LGBT adults.
So, where do we go from here? We do this research. Now what happens next?
Yeah, Kandrian is still kind of in the midst of this 5-year grant, right? But what she hopes to accomplish with it is create a training program for some healthcare providers to make sure that they know how to ask the right questions, right? Make sure that there are multiple answers to this question, not just fit for a specific kind of person. That's one thing she wants to do. And she wants to collect new healthcare forms, right, to create a better focus on gender identity so that these individuals will get the care that they need.
Important stuff. Jaleesa, thank you.